Hello everybody. Now the topic for discussion is orthopedic appliances. Actually in orthodontics we use two types of forces. One is orthodontic force, another is orthopedic force. Orthodontic force usually ranges between 50 to 100 grams and brings about movement of the teeth. Whereas orthopedic force usually ranges from 400 grams or beyond that, and it brings about the changes to the deep skeletal structures. Now, the basis for orthopedic appliances is two: amount of force and duration of force. As I've already said, that amount of force is usually more than 400 grams or 400 grams of force. And duration, usually to bring about skeletal changes, the duration of force application should be as less as 12 to 14 hours per day. Let us know about each and every of these orthopedic appliances in detail. First, coming to headgear. Headgear is one of the most commonly used orthopedic appliances, particularly used during the growth period, and it is used to restrict the growth of the maxilla, particularly in case of class 2 malocclusions, wherein there is a mandible will be of normal growth, but there will be excessive growth of the maxilla. Further restrict the growth of this maxilla, headgears are used. Headgear consists of following components: face bow, force element, head cap or cervical strap. In this figure we can see this is a headgear. What exactly is face bow? Face bow is nothing but a metallic component. It consists of two bows, an outer bow and an inner bow. Both outer bow and inner bow are connected by means of a junction. Here we can see outer bow in this figure, metallic outer bow, inner bow, both connected by means of a junction. Outer bow is actually contoured according to the contour of the face. The ends of it is modified in the form of a hook. These modifications are actually done so as to engage the force elements. Outer bow can be short, long, medium. Short outer bow means outer bow shorter than inner bow. Medium means inner bow and outer bow both of equal length, and long means outer bow longer than inner bow. Next is inner bow. Inner bow is contoured according to dental arch and goes into the buccal tubes of the molars. In a mesial, just mesial to the molar, stops are made in the inner bow so as to prevent the sliding of this inner bow through the buccal tubes. Next is force element. The force element can be elastics, springs or other stretchable materials. Next is head cap or cervical strap. The head cap or the cervical strap is the actual anchorage unit. With the help of this, forces are delivered through forces are delivered by strap. Anchorage is taken from this head cap or cervical strap. Forces are given from these elastics and it is transferred to the dentition and the skeletal structure by means of outer bow and inner bow. What are the principles in the use of headgears? First is center of resistance of dentition. The center of resistance of molar is actually at the mid-root area. Hence, whenever the forces are passed through this mid-root area of the molar, it will cause pure translation or the distal movement of the molar. When it passes from above this center of resistance, it will cause distal tipping of the roots. When it passes from below the center of resistance, it will cause distal tipping of the crown portion. Next is center of resistance of maxilla. Not only the center of resistance of dentition should be taken into consideration, but also the center of resistance of the entire maxilla should be taken into consideration. The center of resistance of maxilla is usually at posterior superior aspect of zygomatico-maxillary suture. Roughly, it is at the between the roots of the premolars. Again, the same thing. When it passes through the center of resistance, it will bring about pure distal translation of the maxilla. If it passes from above or below, it will cause rotation of the maxilla. The point of origin of force. The point of origin of force have to be taken into consideration, like whether it is originating from occiput or from the cervical area. Usually, the forces where they are originated from occipital region, it will cause intrusion as well as distal tipping of the posterior teeth, maxillary posterior teeth. If it is originating from cervical area, it will cause extrusion as well as distal tipping of the maxillary posterior teeth. Next is point of attachment of force. As I have already said that the distal ends of the outer bow is modified in the form of hooks. So this is the point of attachment of force. By altering this length of this outer bow, the amount of action of force, direction of action of force can be altered. What are the various types of headgears? It can be cervical headgear, occipital headgear and combination headgears. Cervical headgears usually gains anchorage from the cervical area of the neck, and whenever the forces are acting through this area, it will cause not only distal tipping of the molars but also cause a little bit extrusion of the posteriors. On the other hand, if the point of origin is from the occipital area, it will cause intrusion of the posteriors as well as distal tipping.